In our current situation, it's hard not to get a little paranoid when you start to feel so much as a tickle in your throat. So on March 16th, when local writer Tomas Mooney woke up with that very irritation, he was understandably worried, but not panicked. But by Wednesday of that week, with the addition of a fever and body aches, his concerns started to rise.
Then is when I started having a little bit of concern and, some anxiety attached to it, just because, you automatically go to the worst possible scenario. And initially I was very concerned and scared, and I tried to get tested, and I wasn't able to because I didn't fit the specific criteria at that time. And so I just kind of started writing it out from then.
Mooney was finally able to get tested on March 27th.
Basically, the reason why I was been able to get tested is because I was in contact with my grandmother, who had been in contact with somebody who had tested positive, and that's basically the route, and they can like trace it, or I guess they can connect the dots back to one of the initial first test confirmations here in Lubbock. So that's how.
Mooney and his grandmother both tested positive for COVID-19, but their experiences were pretty different.
Yes, my grandmother also tested positive. She had where I had just horrible. I felt horrible for 14 days, 12 days. My grandmother really had just the mildest of cases, and she felt bad, I guess the week before I did, and it was just a couple of days, and it was just headache and a little bit of soreness, and just like I said, just kind of just for a couple of days, and but she still tested positive all this time later.
The city of Lubbock has been ramping up its efforts to combat the spread of COVID-19, going as far as issuing a stay-at-home order on March 29th. As the confirmed case count continues to rise, Mooney hopes that people start to take preventative actions more seriously.
Obviously, I'm, early 30s, and I'm relatively healthy, and I did take all this super serious beforehand. I didn't really go out before being sick, and obviously ramped up, use of hand sanitizer and washing hands even more so than usual, and stayed inside, and I obviously still came in contact, and I just hope that people realize that it's very easy to catch this, and if they're not, that they need to ramp up their social distancing and their hand washing and sanitizing more so than they already are,
Mooney went on to explain what having the disease was like.
I had a fever from about Wednesday till about Friday, Saturday of it would go from 102 to 103 in that range, and I just had general body aching, my back and all my joints, my knees, and really my hip joints, my hip sockets hurt so bad, and I had a huge migraine that was all the way into my neck, and I felt dehydrated despite drinking a whole lot of water. And throughout this whole entire time, I lost really a sense of smell and taste. Everything just kind of was bland. I didn't really eat much those first few days. And then I guess about last Saturday, the 21st of March, until this past Friday, the 27th of Friday, basically all of those days, I was just extremely fatigued.
As for the reason he decided to come forward and share his story,
there have been obviously skeptics, or just people who maybe not taking it as nearly as seriously as they should have, and hopefully some name you're able to it makes it a little bit more real if you're your circle of friends on Facebook or someone So
Visit kttz.org for more on how COVID-19 is impacting Lubbock. Send us your stories through Twitter or Instagram at TTU Public Media. For Texas Tech Public Media, I'm Jonathan Seaborn.
COVID-19 coverage is brought to you in part by Texas Mutual Insurance Company, a health and safety-focused workers' compensation provider.